The objectives of the session were to, the idea was to understand how a multidisciplinary field of practice can be addressed with one educational program, how to cater to different professions in one educational program without creating silos, and how to bring professionals with varying competencies and levels of expertise into one common learning environment.
Okay,
So,
and you discussed this with Professor Bart Mollion.
yeah, so Bart Mollion is the past president of the European Pain Federation. He's a professor at the University of Leuven, and he's someone who has a lot of responsibility for our educational projects. So the session was structured as a dialogue between the two of us, with the participants asked to contribute if they understand the challenges, if they have any questions or any thoughts about the issues we were dealing with. So we had an interview scenario where we discussed pain as a case study, really, because the idea was not to try and teach people about pain, but how to show that there are areas of clinical practice which are quite complex and multidisciplinary, and in our case, multi-professional, where an educational approach has to be tailored to that environment. It's not monodisciplinary. It's not sufficient to simply provide pain education for physicians or for pain specialists, but to provide education that is relevant to the various disciplines and the various professions needed for pain management in a real working pain clinic. And Bart gave some examples from his clinic and how that is organized, showing that you need the contributions of, for example, anaesthetists, rehab specialists, neurologists, physios, psychologists, nurses, and how this team works together. So in the actual clinic itself, the teams have meetings together. They make sure that the patient benefits from the collaboration between those different professions. It's not simply that you have these professionals working on the same floor but not speaking to each other and passing the patient from one room to a next, but really working collaboratively. And for the European Pain Federation, this requires us to provide an educational program that tries to replicate this and tries to educate the professionals collectively in ways that allow them to work from a common basis and understand the contribution of each profession.